Good afternoon, Hattiesburg. Thanks for joining us for this Friday afternoon briefing for COVID-19. Today we will talk about today's numbers. We'll go over just a quick glimpse of what the next executive order for COVID-19 in our community might look like. We'll talk about some mask availability and our regular act of courage. Today's numbers, these are system-wide numbers for all four of our healthcare organizations, Forrest General Hospital, Merit Health Wesley, Semri, and Hattiesburg Clinic. Total tests right now, as of today, are 16,992. And some of you may notice that number is actually less than the number we gave yesterday. It turns out today there was a data reconciliation. There were about 100 samples from tests taken earlier this week that could not be processed, and many of those folks had to be tested again. And so that number is actually less today than it was yesterday because those voided tests were reconciled out of the overall number. So of those 16,992 tests now, 1,611 have tested positive, 14,895 have tested negative, and we have 396 tests currently pending. Hospitalizations between Merit Health Wesley and Forrest General, we have 47 patients in the hospital who have tested positive for COVID. That's about 7 over the average for the past 2 weeks. In ICU utilizations, we have 17 who are in the hospital or in the ICU for COVID. These are the most acute patients. That's still over the last 2-week average. And this is how things have trended since the beginning of April. We saw a dip in hospitalizations late last week. That number went up a lot this week, and so we kind of hit numbers that we had not seen yet in terms of hospitalizations. ICU still hovering below the 20 mark. However, what we do know is that those in the hospital may end up in the ICU, and so trying to keep folks out of the hospital is a big step in trying to curtail this in our community. Of course, yesterday we didn't have new numbers. There was a technical issue at the Department of Health, and so today we're giving you the cumulative after 2 days. And so for a 2-day period, Forrest County had a net increase of 5 to 672. Lamar County had a net increase of 9 to go to 287, which brings the metro area total since this began to 959. Our 5-day average is where we look at the number of new positive tests for 1 day and then average it with the 2 days prior, the 2 days after to kind of see where the trends are headed. After last week, we saw a really big increase to start the week. That number in Forrest County has started to level off. We'd like to see that, but because the two counties are in Hattiesburg, they both compose Hattiesburg, we try to give you the trend for the entire area. And so we're about at 20 new positive cases right now per day. We also look at the number of cases inside the past 14 days because COVID tends to have a 14-day life cycle, 14 days or fewer unless you have an adverse reaction. Typically, those that have tested positive in the last 14 days, that gives you a very general estimate on what the number of active cases that may be in your community. And so right now, 149 patients have tested positive in the last 14 days in Forrest County, which means we likely have around 149 active people with COVID right now. And then factoring in the 41 deaths we've had, that means 482 have either recovered or survived COVID. And on the Lamar County side, that number is 56 in the past 14 days. And so when you take all these trends combined since the start of April, you can see that we peaked in Forrest County about the middle of May, which brought our metro area total about 250 active cases. That number fell and then went up again this week, but we're starting to see kind of a leveling and hovering around that 150 mark, which we hope we can stay there or go beyond. In Forrest County, Lamar County is kind of stuck right at 50 active cases since for a good month or so, and so we hope that we can kind of keep that combined to 200 or fewer. Our goal is protecting vulnerable populations, people over the age of 60, people with underlying health conditions. We also want to prevent overrun of the healthcare system. That's why we watch that hospitalization number so closely. And of course, we want to prioritize public health and while giving the business and private sector the room it needs to operate as we reopen. As we reopen, we kind of have these 4 things we lean on to help guide us in that process, particularly as we set policies as a city. First is the widespread availability of testing. The wearing of masks, watching our own data, and of course listening to all voices, business and healthcare. This weekend we will update our executive order. Of course the current one expires on Monday. There will not be many changes in this next round. It will include language to reflect Governor Reeves' order that he issued in his second phase of safe return. We will also do some mild increases to the retail occupancy for both those non-essential retail and the essential retail. And of course, we're going to continue the requirement for masks at retail stores by customers and employees. I know this is something that people are interested in, people ask about a lot. We watch our own data when we decide whether to continue that or not. And the increase in hospitalizations this week was concerning to such a point, especially as we look at what is happening in the counties around us who don't have mask orders. That's why we're going to continue that for at least another week or two. Speaking of masks, there are some opportunities for you to pick up free ones this weekend. You can go to any of our 8 fire stations today or tomorrow on Saturday. Or you can go to the EOC, which is 4080 US Highway 11, and these masks are actually washable that you can continue reusing. And our Act of Courage, today's Act of Courage recognizes a tragic anniversary. Today marks 57 years since civil rights hero Medgar Evers was murdered in the driveway of his Jackson home. When we remember and honor him, and honor other icons of the civil rights movement, we are reminded that the progress toward freedom and equality for all have come at a price. Many have sacrificed. Many in our own community marched and faced the worst of consequences during the struggle. Peaceful demonstration has always played a pivotal role in that story, in that bending of the arc toward justice. As a city, we support those rights to assemble and freely express views and opinions. We work across departments and agencies to ensure a safe environment in which to protest. Our expectation for our personnel and for those protesting is mutual respect. This has been the case over the past 10 days. It will be the case this weekend and in early next week and in the weeks to come. But just one other word. If you plan on coming out to protest this weekend, please be mindful of those around you. Many are in the high-risk category for COVID, either because of their age or because of health condition. And as I just mentioned, the number of hospitalizations reached its highest point this week. And even if you are not over the age of 60, and if you are not diabetic or have another chronic health condition, there will be people present who do have those risk factors. Many who are going to be on the Mobile Street route made the same march 50 plus years ago. And so respect them and watch out for yourself, and please wear a mask. Also practice social distancing. Those are the right things and safe things to do, particularly when we honor those who came before us. And no matter what you do this weekend, please remember to wash your hands, take care of yourself mentally and physically, wear a mask if you go out in public, do only what is essential, and remember, you are safer at home. Please be kind to one another, please be respectful,